That's great. Um, Inflammation relates to the health of your body generally. Everything can be affected by inflammation. If a man has inflammation in his body, the prostate can be enlarged and have problems. You can have gum disease and get heart disease. We talked about that last week. Inflammation is actually really important. So you want to avoid inflammation. When you have inflammation, you increase your clotting factors and you decrease your ability to dissolve or get rid of clots. And what is heart disease?
All right. I think we're going. I'm running solo with Dr. Saunders today. Leslie cannot make it today. So please be patient while I manage everything. And we are going to welcome everybody who's here. So go ahead and send us a chat. And usually we like to hear from where you are. Let me guess. Ryan's here from South Dakota. Who do we have here from Alaska? Someone usually shows up from way over there. Let's see, chats. Here we go. Jerry from St. Paul. Olga from Canada. Hi, everyone from Kansas, my home state. Love it. How are you today, Dr. Scott?
Oh, I'm doing great. This is a great day. It's one of the problems with being in Santa Barbara. It's like we have to say that every day.
We're having some cold weather in South Florida, and it's like my husband says, winter, my favorite day of the year. We get 1 or 2 cold days. Oh, we have James Moore from Santa Barbara on. Do you know him?
Oh, wow.
That's where Dr. Saunders is. Tom from Eugene. Ted from Alaska. There we go. I knew someone was from Alaska. Alma from Queens. Yes. Great. Mary from Iowa. All right, well, today we are just going to talk about some of the basics of heart health. Go back to the basics. It's not the beginning of the year anymore, but we're going to cover some of the standard foundational elements of heart problems and have a good review. Did you guys do kind of the basics yesterday in the diabetes webinar?
Yes.
Yes, you did. So was Leslie there yesterday?
Yeah, she made it, but oh no, she didn't make it. It was just me and Joe.
Just you and Joe. That's got to be good. All right. So one of the questions I had about the basics of healthy heart is a lot of times they talk about BMI, losing weight. Should you go by BMI for weight loss recommendations when you're talking about healthy heart?
That's a great question. And the answer is it's not a good measurement. Body mass index is not a good measurement. If you look at, gosh, I wish I had them. I one time when I talked about this, I pulled them up. A picture of Arnold Schwarzenegger at age 35 and a picture of Arnold Schwarzenegger at age 75 with the same body mass index. But one of them had a big belly and the other one had no belly at all and very big muscles. So the body mass index is the same in both of them, but one of them is the elevated weight due to muscle, and the other one was elevated weight due to fat. And so no, it's not a good measurement for us for knowing your health, but especially heart disease, because heart disease is not specifically related to body mass index, even if it's obesity. In fact, if you look at longevity, you'll see that body mass index is actually a little higher than we expect. Like people that we would call overweight to obese, 25 to 30 body mass index, are the longest lived people. They actually live longer than people who are at a low body mass index, like less than 20. So, it's not a good measurement for longevity. It's not a good measurement for heart health. And one of the things to look at is the way studies are done. So they don't take like thousands of people and follow them over their entire lifetime to be able to say, oh, if your body mass index is big. So consider this as the reason. If you do a, I don't know, 5-year study or a 10-year study, you take a whole bunch of people, thousands of people, and you go, in those 10 years, who is most likely to die? And you say the body mass index below 20 is most likely to die, compared to the body mass above 25 is less likely to die. Why is that? Well, if you're only following someone for 5 or 10 years, you're looking at people at the end of their lives. The ones that are dying, that's the end of their lives. And so if they have cancer, what are they going to have? Well, they're going to get wasting and they're going to have a very low body mass index. If they have tuberculosis or some terrible infection or some other terrible disease or some intestinal problem or brain tumors or whatever people are dying of, they're going to lose weight. And so their body mass index is going to be low. So the way studies are done tell us a lot about whether that's a real number or not. So you have to take that stuff with a grain of salt and go, just because you have a higher body mass index doesn't mean you're going to live longer. It means in the next 10 years, it means you probably don't right now have some terrible disease that you're losing weight because, you're losing weight. And that's a kind of a common thing. So when studies are not longitudinal, when they're time limited, just take it with a grain of salt.
I think that's one of the most important things you've taught us is about how to look at studies, not just medical journal studies, but scientific journals, because that's where more truth is probably found in some of the science than just the medical journals paid by the pharmaceuticals companies.
Yeah.
So I kind of jumped the gun and started asking questions, a little more housekeeping. Put your questions in the Q&A. Dr. Saunders loves to talk to you guys and figure out answers and solutions to what you need. So we are open to all questions heart related, maybe even some not heart related, but put them in the Q&A. That's the best way to reach us. And then let's see, do you want to do a disclaimer for us?
Yeah.
Okay.
So the important thing about the information here is it might apply to you, but then it might not. And so be very careful. Work with your expert, whoever that is, or use the information, apply it appropriately to yourself, because sometimes I'm giving out general information. It may not apply to you. So just apply it properly.
Okay. So it's interesting. We were talking about the basics, and I happen to have a Woman's Day Health magazine that came in, and it had 10 basics of heart health, and they are pretty much the same things that we cover in the Healthy Heart Solution Kit. Now, let me tell you what, you're going to get your values in this and not so much in this. This is like 1 page worth of information, and this is how many pages? I don't know, 120 pages in here. But I was surprised and thankful that they got some good information going on basically here. One of the things they highlighted on the front of the cover was the role of inflammation in heart health. So what's so important about inflammation, how it relates to your heart?
Okay, that's great. Inflammation relates to the health of your body generally. Everything can be affected by inflammation. If a man has inflammation in his body, the prostate can then be enlarged and have problems. You can have gum disease and get heart disease. We talked about that last week. Inflammation is actually really important. So you want to avoid inflammation. When you have inflammation, you increase your clotting factors and you decrease your ability to dissolve or get rid of clots. And what is heart disease? Well, it's clots. Clots in your arteries that form. You have an artery, and whenever there's any damage to the lining of the artery, that's called the glycocalyx, then it'll form a clot on the inside, and that clot has to be paved over with APCs, progenitor cells, and then so it forms a little bit smaller artery with the little clot on it. And then that clot has to be dissolved, and it dissolves over time the same way you see anything dissolve over time. You know, it takes a week or whatever to dissolve. Well, if you have inflammation, you don't dissolve it very quickly. In fact, sometimes not at all. You get what's called an organized clot. And organized means it's no longer just a clot with fibrin in it. It starts forming scar tissue, and then you get calcium deposits in it, and it becomes a tissue instead of just a clot with blood and fibrin split products in it. So the inflammation prevents the dissolution, getting rid of the clot. And so what happens is then you have this area, you have this little clot that forms. And now you have a little bump there in your artery. And so you're more likely to lose your glycocalyx, and then you get another little clot there. And then you get another little clot there, because the inflammation makes you clot more easily. And you get layer upon layer of clots until your artery is getting smaller and smaller and smaller until you have this big clot with just a little artery left in it. And that's what heart disease is. That's what the disease is when you can't get enough blood flow. So inflammation causes both problems, both more clotting and less dissolving of clots.
So what's the biggest contributor of inflammation in today's modern society? What should our listeners be watching out for?
Okay, probably number one is burning sugar. You may sound, that may sound kind of dumb. You go, wait a minute, we live on sugar. No, actually, reality or the best function of the metabolism is to burn 60% of your carbohydrates from fat and only about 40% from sugar. And that 40%, most of that, like half of that, is going to be your brain. And so you really, in your body, you're actually burning only a little bit of sugar. And so your whole body burns as much sugar as your brain. And that is kind of an ideal situation. When people have insulin resistance, then they have more inflammation, partly because they're making more oxygen-free radicals. And those oxygen-free radicals come because sugar, glucose, is a high-octane fuel. It makes a lot of oxygen-free radicals. Fat is a relatively low-octane fuel. So now if you're burning 60% glucose and 40% fat, that means most of your body is running on sugar, and all over now you're making a lot of oxygen-free radicals and getting a lot of inflammation. So people with type 2 diabetes, but even before you have type 2, you can have heart disease from inflammation because you have insulin resistance, and your blood sugar is perfectly normal, but you're still burning 60% fat and 40% glucose, or 80% fat and 20% glucose, or 80% glucose and 20% fat. So that excess glucose is another source of inflammation. And that's probably the major one. The second most common one would be the omega-6 to omega-3 ratio. Omega-6 fatty acids are the ones that promote inflammation. Omega-3 fatty acids suppress inflammation. And the average American has like 7 times to 14 times more omega-6 than omega-3. And that's why it's often recommended to take fish oil. Fish oil is omega-3 to get that up. And so an optimum level is somewhere around 2 to 1 is optimal. Two times more omega-6 than omega-3. So twice as much omega-6 as omega-3 is kind of an optimum. But it's really hard because all of the oils have omega-6 and only a few of them have omega-3. You get chia seeds, flax seeds, fish. And that's pretty much all you're going to get omega-3. People go walnuts. Well, guess what? Walnuts have 6 times more omega-6 than omega-3. So yes, they have omega-3, but they got a lot more omega-6. So that doesn't help you at all. It's the same with like canola oil, which has some omega-3. And so you have to be kind of careful with the oils. Another one was like sunflower oil, has practically all omega-6 and no omega-3. Cottonseed oil has a lot of omega-6 and no omega-3. So, these vegetable oils that we're using have a lot of omega-6 and very little omega-3, if any at all. Some of them, like cottonseed oil, none at all.
What about avocado oil, olive oil, some of the other
Okay,
common kitchen
that's a
oil?
that's a great question. So 3, avocado oil, olive oil, coconut oil. Okay, so these are like common things we might have in the kitchen and use all the time. None of them have significant amounts of omega-3. They're really omega-9 oils, but they do have some omega-6 and omega-3, but it's a very small amount. So if you look at like avocado oil and olive oil, you have 16 times more omega-6 than omega-3. So it doesn't give you a good ratio to do that. And it's fine because there's very little of it. So you can push up that ratio with like 1 fish oil capsule, and you're gonna be way more omega-3 than omega-6 just because there's very little of it.
So we happen to have an a supplement, which is why we created it, because we know it's so valuable for heart health. So if you go to bartonwebinar.com, you can find some of our supplements, use the code webinar25 to get 25% off your order. Right, I do see some questions coming in. We're going to get to those soon. One of the other basic questions I had was about exercise. How rigorous should it be when you have heart issues? Like, I always think of someone with heart problems, they should not be running. They should not be like doing hard exercise. But is it really, what exercise would you recommend then for safe heart health?
Okay. Safety is a big thing. So let's look at the history of that. Yeah. When my aunt was very young, 6 years old, I think, she got scarlet fever and had rheumatic fever. Rheumatic fever is a heart problem. And so what the doctor said was, because you have this heart problem, you need to be in bed for a year. Wow. So this poor little girl, 6-year-old girl, was not allowed out of bed. Like, she had to use a bedpan like that, not out of bed. So, and that was the medical treatment for keeping her heart safe from this rheumatic fever, which is a valvular condition of the heart from scarlet fever, from it's a streptococcus strep infection, like strep throat. Mm-hmm. So tonsillitis. So then how did that help her? Well, we don't know. So let's look at the overall statistics. What illnesses are benefited by rest?
All of them.
None of them.
I got that wrong.
There is not a single illness that has been studied that is benefited by rest. And this is like serious stuff, like a woman who gets preterm labor, early in pregnancy, that has a chance of, aborting the fetus. And they'd say, no, you have to be on strict bed rest. Guess what? It probably doesn't matter. Heart disease.
This is different than sleep. Sleep is what you recommend, but you're talking about rest, not getting exercise, just sitting around and absorbing the couch.
Yeah, laying in bed for weeks or months or years or whatever. Okay, so then since bed rest has been recommended for a whole bunch of different illnesses, from infectious diseases like tuberculosis and scarlet fever and heart diseases and all that, there were studies actually done on what does bed rest help? And the answer is nothing. So then that comes to our next part, was the answer to your question. So what does exercise help? And now your answer is correct. Everything. There is nothing that exercise does not help, from depression and anxiety to infectious diseases, to heart disease, to diabetes, to cancer. You cannot name a single illness that exercise does not benefit you in some way. So Now your question is how much and what do I recommend? Well, for each of you, it's going to be individual. So, if you go to your cardiologist and the cardiologist said, gee, you have 90% blockage in your left anterior descending artery, which is one of the big main ones. Then you're not going to go out and run a marathon the next day and go, I don't care, I'm just going to go out and, you have to be reasonable. But the way to look at it is you go to your limit, whatever that is. So when we talk about doing HIIT, high intensity interval training, this HIIT type exercises, everybo's not the same. When I sprint, I don't do a 100-yard dash in 5 seconds. I probably do it in a couple of minutes. That's my 100-yard dash. So everybody's a little different. I've been trying. I run about 3 miles a day, and I've been trying to get under a 10-minute mile. I have not been able to get under a 10-minute mile. Okay, but I'm not pushing it that hard. I'm not like pushing it to my limit all the time. And that's kind of where you go. You go kind of up to your limit and then rest, and then go up to your limit and then rest. And then as your limit increases, you increase just a little bit over time. You don't have to kill yourself, because that's what people do. They go out January 1st, I'm going to go to the gym this year. I'm going to work out. And you go and you push really hard and you're sore and you go, I can't go back to the gym. You know what? And there's so many people who start their gym membership in January. In fact, my son goes to the gym and he said, everybody there says, don't go in January, wait till February when everybody leaves. So the amount of exercise will depend on what your limits are. And all you need to do is push the limit and increase a little bit at a time.
Mm-hmm. I find people think they're athletic or they're not. And it's time to demystify that anybody can exercise. You don't have to look like you exercise, but just start exercising, get out there, do what you enjoy for 5 minutes, then work towards 10 minutes. Like, it doesn't have to be in your mind, I'm going to go to the gym and do hard weight lifting for the next year. Just start with something you can do. Okay. What about something that maybe we touch on, but I want to talk about how social stability helps heart health, being around people, and how does that affect your heart?
Oh, that is so, if you could think of the most basic thing for heart health, it's not your diet, it's not exercise, it's no supplement. It is really, it's not smoking, it's not blood pressure, it's not cholesterol, it's connection with people. There was a psychiatrist who did a study through the 1970s, 80s, and at the end of his long-term longitudinal study, he said, pretty much the conclusion is isolation kills. And what do people die of? A broken heart disease. And the broken heart is not a small thing. You guys think that, that's something that kind of a peripheral or lateral thing. No, 60% of people who go in, there was a study done in a New York heart hospital, where anybody in New York City who was having a heart attack would go to this hospital, and they had 24-hour catheterization lab was open, and there was always a surgeon there to do heart surgery for people that needed immediate surgery. And so everybody would be rushed to that hospital if they were having heart attacks. And guess what they found? 60% of people who came in with a documented heart attack had clear arteries.
Wow.
They had spasms of their arteries. It's called Prinzmetal's angina. This is common. This is a problem, and people die from it. It's not a small thing. So this connecting with people, don't underestimate it. When we look at the blue zones and everybody says, oh, you have to eat beans and rice because that's what they eat in Okinawa. Oh, you have to eat fish because that's what they eat in or you have to be vegan because that's what they eat in Sardinia. I don't, you know, these people come up with food and they forget that the blue zones were mostly about connection. These are people who had not just like one person connection or friends around, they had generations living in the same household. They had grandparents and aunts and uncles that they regularly connected with and had a relationship with. So isolation kills. That's what the psychiatrists say. Isolation kills. And people die of a broken heart. So that's heart disease in a nutshell. Thank you for asking.
Well, that's why we're here, to connect with you guys. So let this be one thing in your life where you actually feel like you're connected. Okay,
I'm not going to die of heart disease because
yeah,
of my
just by being
webinar.
here. Yeah. Well, hopefully you're connecting with us, but let's see. Okay, since we're talking about connection, let's look at some of the questions that are coming in. So Alma asks, I had an echocardiogram recently. I do get palpitations and quotes sometimes. However, what they found is leaky valves, trace mitral, trace tricuspid, but mild aortic although the valves are physically normal, heart size and pumping strength normal. Any recommendations to help? I take a beta blocker for hypertension, currently controlled.
Okay, so echocardiograms are awesome. See, you have normal strength. In other words, it didn't say what your ejection fraction was, but it's probably over 55%, right? So, so you're in the normal range, 60%, 70%, whatever. And your valves, those trace regurgitation in the valves is not really a problem. The mild aortic valve might be something, but if the valves are otherwise, you said physically normal, their anatomy is normal, then that's probably not an issue either. So your next question is, so what do I do? Well, this is great because now you have some knowledge and you know that anatomically, physically, your heart is normal. So now you look at functionality. You look for the functionality of your heart. How are you going to get the proper energy to your heart so that there's enough mitochondria in there so that your heart keeps pumping every single time and never has to rest because you've got plenty of mitochondria in there. So making sure you have adequate nutrition. And so, for example, there are 4 nutrients that Dr. Stephen Sinatra did a lot of research on congestive heart failure, how to prevent congestive heart failure, getting adequate nutrition. Make sure you get enough magnesium. And magnesium is found in green vegetables and nuts and seeds and whole grains. Make sure you get enough coenzyme Q10. Well, coenzyme Q10 you make in your body. It's not really a vitamin. But if you're eating fruits and vegetables, you're going to make and get adequate CoQ10. And a D-ribose, the same thing. If you're getting fruits and vegetables, you're going to get D-ribose. You don't have to add the spoonfuls of it necessarily. And then the other one is L-carnitine. And L-carnitine is really important. You need that in your body. People who have carnitine deficiencies, they really get low mitochondrial function. You don't have to take L-carnitine if you're eating a good nutritious diet that is low in processed foods. So then there's that. Okay, one more thing to consider is inflammation that we've talked about already. Avoiding things that are high in sugar, which tend to cause inflammation, and then avoiding things that are high in omega-6 oils. So avoid cottonseed oil and vegetable oils and hydrogenated oils, and then eat more fish and flax seeds and chia seeds. Those are pretty much the only 3 foods that you can get omega-3 oils from, or at least to change your ratio and getting more omega-3 oils. So those are the best things to do because you have normal anatomy.
Thank you. Hope that helps, Alma. All right. Tom asks, is it better to exercise before or after you eat a meal? Covert Bailey, I'm not sure if that's a person, says eat before. Nutritionists say eat after. Say eat and then exercise.
Okay. So there is a lot of research on this, and in looking at what's available, the reason nutritionists say to eat after is so that you have an adequate amount of sugar. Really, they're looking at glucose for energy, so that you can run on glucose. Your muscles will take up, if you're exercising after you eat, your muscles will suck up the glucose, and then you won't get high blood sugar or anything. So there's something to that. But if you have a good metabolism and you're fasting periodically, and you don't have insulin resistance, you're actually better off exercising with an empty stomach and eating afterwards. And if you get like, I've just read this recently, over 30 grams of protein, and think about that, like an egg, one egg is like what, 6 or 7 grams of protein. So, you got to eat like 4 or 5 eggs to get 30 grams of protein. Fish, a 3-ounce or 4-ounce fish or steak is get about 30 grams of protein. So it's not that you can't get that, it's that it requires eating protein. And if you eat that after you exercise, especially in the morning, you make something called mTOR that builds muscles. So the people that are saying eat after are generally saying eat protein after you exercise and you're going to build muscles. The people that are talking about eating before you exercise are looking at it from a completely different point of view and saying, oh, you'll have better sugar, more glucose, less insulin resistance if you exercise after. So one's looking at proteins, one looking at carbs.
Okay. And you could probably do protein powder. A lot of people do protein powder after they eat to try to get their protein in as well, or after they exercise.
Yeah.
All right. Gerald Fry asks, or says, I'm recovering from nasty infectious foot surgery. Is
Ouch.
diet restriction, intermittent fasting, good, bad, or neutral in terms of recovery? That's a good question, Gerald.
Okay. Great question. When you're recovering from anything, from surgery, from anything, you want to be in anabolic mode. So you put your body in anabolic mode when your stomach is empty. An empty stomach makes a hormone called ghrelin, Grelin, growth hormone releasing hormone. The growth hormone is what you want. That's what you want because that repairs your body. But then you have to say, wait a minute, how am I going to get the nutrients I need to fix that? So if you have something like an intermittent fast, like time restricted eating is what you're talking about, restrict it to the morning, and because that's when you release your cortisol. That's when your stomach and your liver and intestines are working to digest and absorb and process all of your nutrients and food and get rid of toxins. If you eat in the evening, then you just store it as fat because your liver can't process it. Your intestines don't have all the absorptive capacity. So you dump all the fat into your bile system. No, not the biliary system. It goes into anyway, it goes right into the blood. Yeah, it goes directly into the blood, and then you just store it. So if you eat in the morning and then you have an empty stomach the rest of the time, that empty stomach is making ghrelin, you're making growth hormone, putting you in anabolic mode, especially at night. Because right around 10 o'clock at night, if you're asleep, you get this spike of human growth hormone that initiates all of the other hormones, all of the other anabolic hormones that do all the repair. So the best way to repair is to eat in the morning, have protein, and then have an empty stomach for the rest of the day. So time restricted feeding. If you have like a 5-hour window of eating or something like that, that's fine. That works too.
Mm-hmm.
That's a great question, because it doesn't, like the foot surgery, infectious disease, all of those things are repaired during the time you're in anabolic mode. So that's when your stomach is empty.
Mm-hmm. Do you think that having an empty stomach before you go into surgery is a different thing? It's basically helping you stay safe under
Right.
anesthesia. But I
Correct.
wonder how much he can repair before going into surgery by doing fasting as well.
Well, it
Yeah.
helps. It
Yeah.
helps to before you go into surgery, they tell you to have an empty stomach so that you don't get stuff from your
Mhm.
stomach going up into your lungs or whatever.
Yeah.
But also, you initiate that ghrelin response, and you still have you go into repair mode for surgery. I think that's a good thing to do anyway.
All right. Let's not get started on hospital food. All right, Charles Clark. In previous sessions, you've mentioned that there may be some cleansing benefit to the arteries from taking niacin. What dose should you take for maintenance after titering into niacin?
Okay, so niacin is a vitamin B3 analog, and niacin has to be made into niacinamide. And that process of making niacin into niacinamide in the liver stops the liver from making LDL cholesterol. It's kind of a complex, indirect mechanism. But by inhibiting the LDL cholesterol, then people say that the niacin is a better choice for lowering that than like a statin or something like that. And that's been shown to be true. You have to be kind of careful with the long-acting niacin, the sustained release. It tends to cause liver damage, and so that may not be the best. But the dose that you can take, I've had it requires a pretty high dose. So if you end up with like 500 milligrams 3 times a day as a dose, and that you talked about titering up. Of course, you're titering up because that effect of flushing that you get because of the release of histamine goes away pretty quickly, or goes away over time. So you kind of titer up, and you end up with somewhere around 500 milligrams 3 times a day. 1,500 milligrams a day is about right.
Okay. Joan asks, when during the day to drink water? Yesterday, I heard you say that it's not good to sip water all day. So 4 glasses all day?
Yeah, 4 glasses all day would be okay. 2 glasses all day. I usually have people drink about 32 ounces a day. And then when you're eating food, if you're eating fruit and vegetables and getting a lot of fiber in your diet, you usually get a lot of water with it. So it's not that that's all you're getting. All of your food has water in it too. And if you're eating fruit and vegetables, it's mostly water by far. So when to drink the water, kind of, as I've read different articles and different opinions on this, there are people that say you should force the water even if you're not thirsty. And then I've seen some other articles that say that that's not a good idea, and they show some evidence that it lowers your sodium levels, so it constricts your blood volume, causing actually more vascular disease. The most reasonable article I read that I agree with is to drink when you're thirsty. If you're thirsty, drink water. And if you're still thirsty, drink some more water. And if you're thirsty all the time and drinking water constantly, then you've got a sodium problem or a potassium problem. And you got to fix that first. And sometimes the best way to do that is to do no food, no water for 24 hours. Have a complete day without food or water. And that kind of that's the reset for everything. It's just don't put anything in your stomach, including water.
Wow. 24 hours. You can do anything for 24 hours, right? It's not that long.
Yeah.
All right. Elmar says, I'm 67, relatively fit, BMI 25. I eat from 11 a.m. to around 6 or 7 p.m. for a long time, counting fiber, vitamins, minerals, taking supplements, exercise as much as I can, walking, going to the gym, heavy weights. Blood tests are perfect. Had heart stress test recently, no problems. I don't take any medicine, but my blood pressure, low number, almost always 90 to 100. I just finished my 5-day total fasting and it's still high. What could be wrong?
Okay, the diastolic blood pressure over 90, that is high blood pressure. What could be wrong? Gosh. Okay, so that kind of a thing you could test. So do some tests. Look for renal artery stenosis. And what that is a constricting of the arteries that go to the kidneys. And if the kidneys don't have enough blood flow, they raise the blood pressure. Another thing to look for would be Cushing's, which is too much adrenal hormones. So that's adrenaline, epinephrine, norepinephrine, and cortisol, and they will cause that diastolic blood pressure to go up as well. Another thing to look for would be the aldosterone to renin ratio. That's a great test to do. It's called an ARR, and ask your doctor for the ARR because that will determine whether if it's an aldosterone, which is another adrenal hormone, or kidney, because that ratio is important because they work together. And that can tell you what's going on. But I got to tell you, blood pressure medication can affect that. So you have to be careful to be off blood pressure medication when you do these tests. Otherwise, those hormones might be out of balance. There are other possibilities, but look for those first. Those are some of the more common things that would signal, would tell you where the problem is.
All right, what are those two things again?
The adrenal glands and the kidneys. Okay. So the kidneys, there's a couple of tests. One of them is an ultrasound of the renal artery. And then the other one is called the renin, but aldosterone to renin ratio, and then all of the adrenal tests should include cortisol, metanephrines, and aldosterone to renin ratio.
All right, we hope that helps, Omar. Come back and let us know what you find out. All right, Carolyn asks, where can I get Dr. Saunders' heart healthy supplements? Well, I can help you with that. You go to bartonwebinar.com, use Barton Webinar for 25% off, or you can just go to bartonnutrition.com, find all of our supplements listed there, and then use Barton Webinar again as a code to get 25% off. All right, Mirabella, is there a correlation between hunger and irregular heartbeats? I'm pre-diabetic, and when I attempted to do intermittent fasting, when I began to feel hungry, I had an EKG and I was told it was PAX. And because my heart rate was in the normal range, I would not be a candidate for drugs. These beats are intermittent and brief. I now use breathing techniques and it disappears. It mostly seems to occur with hunger. I'm taking Synachroma and fiber greens, no meds. I was on Proglyco supplements, but stopped it when I started the Barton supplements. So she's wanting to know if there. Yeah,
That's a great question. So PACs is premature atrial contractions. And like they said, that's not, by itself is not important, but it's a harbinger of other things. And what it means is that if you have these PACs over time, then as they get worse, that you end up with atrial fibrillation, where your atrium is just fibrillating. So in order to avoid atrial fibrillation and to fix this problem, the number one thing is to deal with your metabolism, because this is the primary problem. The metabolism means how your energy is produced. So what you have when you have insulin resistance or prediabetes is the insulin, relative high insulin stops your cells from using fat for energy and tells them they need to use sugar for energy because you have relatively high amounts of sugar. So then you're burning a lot of sugar with a little bit of fat. And that's what we talked about in the beginning. So switch that around. You got to train your body to burn fat. It's a training process. And so if you're pre-diabetic, go back to the Barton Publishing and get the Diabetes Solution Kit and start with phase 1 as a training for your fat burning metabolism. because that's a starting point for switching that metabolism.
The old saying of calories in, calories out doesn't apply anymore, does it? Because you really have to think about your fats and your proteins and
your hormones.
yes.
Yeah, you're right. It's
okay. Let's see. Keith Rogers says, I am a type 2 diabetic for 26 years, well controlled, 5.6 A1C. A recent upper GI CT showed developing arteriosclerosis development near heart. How can that be addressed and reversed?
okay. A CT scan showed arterial sclerosis in the heart. Okay. So how could that be reversed? So that's, I often do that test. I do a coronary calcium score, and it gives me a number of how much calcium is in the heart. But if you can see it, and you know, if there's a significant amount there to be seen on a CT scan, then that's a good reason to say, okay, there you have atherosclerotic heart disease. You have it. Now, you don't necessarily have a limitation in blood flow to the heart yet, but there is some disease there. So here's why it happens. It happens because clots are forming because you don't have enough of the glycocalyx, because there's damage to the lining of your arteries, because you have high inflammation, so you have more clotting, and you don't dissolve the clots more easily. So all of those factors kind of work together. So the question of what to do is what this webinar is all about. That's all the stuff we're talking about and that we've talked about already. Lower your inflammation, get your omega-3 to omega-6 ratio. Omega-6 to omega-3 should be about 2, maybe 4, 2 to 4, especially in someone that has that. Start taking vitamin K. Vitamin K takes calcium out of soft tissues and puts it into bones so that the calcium can deposit in your bones instead of in your tissues. And that'll allow you to dissolve the clots more easily either. Take the decrease inflammation, connect with people, make more, take more time to connect with people and on an intimate level, and you know, be familiar with people and love people. That makes a big difference too. Inflammation, and then omega-3. Yeah, all of those things.
All right. All right. Speaking of inflammation, Charles asks, is curcumin an effective inflammation reducer?
Yes, but look at curcumin as a temporary thing. So if you use turmeric, then with curcumin, that's where it comes from. Then and you usually use that for a period of time, like you have this acute inflammation or something. You've had, I don't know, surgery, or you've had some infection, or you've had some damage or something, and you're using it for arthritis or something like that. That's still a temporary thing until the body heals. The body should heal from everything. People think, oh yeah, I had that accident 20 years ago and that's why my back still hurts. No, that's not what happens. Normal people heal. I had a guy who was a motorcyclist, motocross, off-road kind of stuff. And he had a bad accident, and he was in a body cast, and he had like broken arm, broken ribs, broken pelvis, broken leg, broken back. And so he's in a body cast for, I don't know, 6 weeks. And then he's in physical therapy for months and months. And he, you know what? He's back out riding motorcycles and he doesn't have any pain at all. So you can't blame it on that. The body should heal. And if it doesn't heal, why not? Well, maybe it's because you weren't anabolic. The anabolic metabolism is what heals everything in the body. So being anabolic is a good place to start. Having sufficient nutrition, that's a good thing to have. Decrease inflammation, have connections with people. That's the decreased stress. So, you know, we have like ashwagandha as part of the supplement. But and there's a reason for that. That lowers the stress response. But anything you take, curcumin, whatever it is temporary. What really works is how your lifestyle is, and how you're connecting with people, and how you eat, and how you act, and how you live.
So good. Does garlic help your heart?
Garlic, gosh, specifically help the heart. Garlic is wonderful for a lot of things. I'm trying to think of it.
I would see garlic as something that people take for blood pressure.
Yeah. So garlic inhibits clotting. So in that way, yeah, I think I'm trying to think of a study, and I can't think of a single study that is specific to garlic and heart disease. But you're right. People take it for blood pressure, and it does prevent clots from forming. So if it prevents clots, it should prevent heart disease.
Any idea how much a garlic a day you would take?
Oh, I don't know. I told a woman one time to eat garlic a day, and I was thinking like one
Clove.
No, the clove is the whole thing, right? No, that's the bulb. Yeah.
Yeah.
So I was thinking one clove, and she was eating one bulb.
Oh
So she was popping cloves of garlic all day long. She walked in the room, and I was like, "Woo, garlic! You like garlic, don't you?" She goes, "Yeah, I'm eating it raw." And I'm like, wow, I tried a raw clove. My grandmother used to pop raw cloves of garlic, and I tried one once, and man, that stuff is potent.
Spicy.
Yeah, it's spicy.
All right. James says, I have a high CAC score, 1,000. Is there anything that can be done to lower it, or is it permanent?
Okay. Coronary artery calcium score of 1,000 is quite high at any age. Even if you're 80 years old, that's a pretty high level. So when you're in like 70s, up to 400 is okay. 1,000 is high. You definitely have atherosclerotic disease of your heart. So don't focus on the symptom. That's the symptom. That's not the problem. Go back to, I'll give you an example. I had somebody whose coronary calcium score was 5,000, 5 times as much calcium as you currently have. And so he did, and he had like chest pain, heart disease. He couldn't walk 10 feet without getting chest pain. So that's how bad he was. He went to the cardiologist. Cardiologist said, dude, if you don't have bypass surgery, you are going to be dead in a month. There's just no way, because your arteries are all blocked up. This is really bad. So he said, I don't want to go through that surgery. I know what happens. People always have strokes. They have brain problems. I don't want to do that. So I don't want to do the surgery. What can I do instead? So we talked about options, and he decided he was going to do a cleanse. So he did a 30-day water cleanse where he only drank water for 30 days. And at the end of 30 days, he had 0 chest pain, playing a full tennis match. And he was a tennis pro. This is not just a hitting the ball match. This is a real hitting tennis match. And then he would go work out at the gym with weights, and he had no chest pain at all. So he goes, I'm really curious as to the reversing of that coronary calcium score. So we repeated his coronary calcium score. It was 7,000.
What? How'd that happen?
That's what he said. That's what I said. What the heck? Don't focus on the symptom. Look at functionality is a much better way. So yes, you have heart disease. Yes, you have to do something about it. Yes, you need to clear your arteries, but don't expect that calcium is going to go away. That's not the issue.
And really, you can find a lot of the answers in our Healthy Heart Supplement. We're talking about some of the core foundations of building and reversing heart disease, but get this and follow the program. There's 3 phases. Do number 1 to start. Okay. Elmar has a follow-up question. Does ARR stand for aldosterone-renin ratio? That was the test. Okay.
Yes.
All right.
R.
And then
No, it stands for R.
R matey, R Elmar. Okay. Tom asks, how do you determine the omega-3 almost omega-6 ratio?
Okay, it's omega-6 to omega-3 because omega-6 is higher. That way you're not dealing with decimal points. So it's omega-6 to omega-3 ratio. And I send them to Quest. I send them to all the labs. It's really easy to do. Boston Heart does the omega-6 to omega-3 ratio. So no matter what heart test you have, there should be an omega-6 to omega-3 ratio. The regular lipid panel doesn't have it, but if it's an extended heart panel, lipid panel, then that should have it. So look at your lab. Your lab should have it, and it's easy to order. You can just write omega-6 omega-6/3, and you'll get that.
Okay. So James Moore types back, by the way, I have no symptoms from my CAC score and ride my bike around 6,000 miles a year, including climbing Gibraltar Road at least once per week. Dr. Saunders will understand that reference.
Yeah, I get that. Okay. So yeah, that's kind of the issue is not the coronary calcium. That's just to tell you, that you have vascular disease. There's vascular atherosclerosis. So if you want to reverse it, you might try something else. I've actually had people do this with vitamin K. So you take vitamin K in fairly high amounts, like 300 micrograms to 1 milligram a day, and the vitamin K prevents or takes the calcium out of the soft tissues and puts it into your bones. So that's something it might reverse that process.
All right, Tom Wigg says, thank you much for these answers. Eugene asks, where can I view previous webinars? Guess what? bartonwebinar.com. You can also find, there's a link to our YouTube channel and you can watch all those, including Healthy Heart and Diabetes. And then the last one is not a question. It's just a comment from Michelle Starr, not a question. Just want to thank you for teaching. Thank you all for teaching us. It is so helpful and the products are awesome. I'm truly grateful. Michelle from Cleveland.
Oh, how nice.
Yes, thank you, Michelle. We love hearing feedback like that. We love helping you guys. Yeah.
So we don't get heart disease.
Yes, exactly. All right. Well, this is a wrap for today. It's been good. Right. And I love answering your questions. Thank you, Dr. Saunders. Have a good rest of your day, and we'll see the rest of you next week. Bye.